Hi, this is Dr. Annette Mercatant from the St. Clair County Health Department. We know how frustrating it has been to try and access vaccine in the last week. Vaccine has only been available to the 65 and older population for a week, and we are anxious to get it to you. But the reality is we just don't have that much vaccine to distribute. We are still actively trying to vaccinate all of our essential workers as well. So as we go through this process, we really need to ask for your patience and kindness, and mostly just your patience as we work through this. There will eventually be enough vaccine for everyone. So let's look at the process we have in place right now. I know it's not ideal, and we will continue to work on improving it. But right now we receive our notification for how much vaccine we're going to receive on Fridays. Typically Friday mornings, but sometimes it's taking a little longer into the early afternoon. Once we know how much vaccine we're going to receive, we sit down and we decide how to distribute that vaccine between the clinics that are designated for essential workers and those clinics that are open to the 65 and older population. The 65 and older population clinic will be put on a link on our website to schedule appointments as soon as we know how much appointments to open up. So that's generally going to be Friday afternoon, early Friday evening that we'll put that up. You know, last week that clinic filled up in 5 minutes. So we know that there's a lot of people anxiously waiting and watching for that to open up. But if that's the only amount of vaccine we have, that's really all we can do. So if the clinic is closed by the time you get to that link, please just close down and come back maybe the following week. So that's the over 65 clinic. We are going to hold next week's clinic in Marine City at the Washington Life Center, and we just urge everyone to be patient with that process. As we do know that not everybody has access to a computer. We know that not everyone is comfortable using a computer to schedule. We are working on a solution. Hopefully in the very near future you will have a dedicated phone line to call or a resource where you can call someone and they can schedule the appointment for you. So again, we appreciate your patience, and as soon as that system's up and running, we'll let you know how to access that as well. The essential worker clinics are also going to continue next week, but those individuals will receive the link to their clinic scheduling process through their employer. So those individuals, if you're in an essential worker category, you do not need to go to our website to schedule an appointment. Okay? So I hope that clarifies things. I wish you all well. We're going to get to all of you in time. Just be patient.